Good morning and welcome to the Engage EHS Summit. So first off, I think it's great that you're all here attending with us. Under normal circumstances, we would love to be running these events face-to-face, running our customer workshops, running our innovation councils as we do in the real world. But at times as they are, we are kind of going to be delivering all of this online. So I suppose what it has done is given us a chance to focus on creating some great online content, some great discussions. We've got some great panelists and hopefully some great learning opportunities over the next couple of days. So we're running today and tomorrow. So please do try and attend whatever you can, whatever's of interest. There's some really interesting topics, I think, for customers and anyone that's interested in EHS that are joining us here over the next few days. And while we're doing that, hopefully we're going to be raising some money for two great causes across the UK and Ireland. So really glad that you can all join us and delighted to kick off today's session. So we'll kind of start off with a little bit of housekeeping, if that's okay. There's a couple of things that we have to just talk through and hopefully get everybody tuned in to how the platform works and what we're going to be doing, and then I will introduce our speakers. So first one that I have is the chat. If you see on the right-hand side of your screen, there is a few different things. There's a little arrow. If you're not seeing it, that might bring it out. And if it's already expanded, you should see some options which say chat, polls, people, and Q&A. So the chat option is there. That's you guys can talk to each other. You can post up comments. You can give us a shout and tell us where you're tuning in from. So all of that would be really good. I can see Dave, our marketing manager, has already been on apologizing for our delay. That was my fault. So, but here we are. So use that chat, talk to each other, post up any comments you have. That's absolutely fine. And use that to bounce ideas around yourselves as well. The Q&A is very much focused on asking our panelists some questions. So we have Laura here who's managing the event. Laura is going to be taking all those Q&A questions in and then at the right time feeding them back to us. So if you do have questions directly for the panelists or on the topics that we're talking about, please try and put them in the Q&A, and that will keep us focused on those and we won't miss them in the chat. There's also a poll section. So the polls, it is online. Obviously, when we're face-to-face, it's easier to talk to people and get people's opinions. But when we're doing these events with the poll, we're going to throw out some questions that we think are relevant for the content that we're going through. And if you guys can please try and interact with that, it'd be hugely helpful. So we'll put up some questions relating to the various topics. You'll see those questions pop up and we'll be publishing the results. So as you click, you should see the kind of up-to-date results for those polls. So there's probably going to be a few of those as we go through each of the sessions, whether they're content sessions or workshop sessions with customers. Again, we'll be asking just for some feedback around that. So the same process will apply for all of these events. So yeah, please, if you see that, don't be afraid to get involved and give us some feedback. I think that'll be hugely valuable. And then just another note around recordings. So everything here will be recorded. You'll be able to log back into the portal after the sessions finish, and the recordings will be visible within the portal. You can use that login if you have to dip off and do something else, or the kids run in because you're working from home and start to entertain you with something else that you have to get distracted from. You can come back in, you can read up on that, you can listen back in again to each of the sessions. So those recordings will be there. And then following the event, we will also be sending out some of the content. So Laura and the team will be putting together some blogs and content pieces around each of these sessions. So again, it'll be sent out to you via that mechanism as well. And then last, but probably certainly I would say maybe the most important, we are running these events for charity. So if you can please, if you haven't done so already, try and donate something towards the causes. All of our speakers have kind of donated their time, free of charge. There's hopefully a lot of benefit for some of you guys as you're kind of listening in. So if you have the ability at all, if there's anything you can support with, there's two great charities, the NHS charities together in the UK and St. James's Foundation, Hospital Foundation in Ireland. So both frontline charities, which at the current time and the current environment are probably close to all of our hearts. And we understand that those guys are under serious pressure and doing amazing work. So anything we can do to support, I think, is a good thing. So without further ado, we shall introduce our speakers that we have here for today. So starting off, we have Gavin. Gavin Rees is partner and head of regulatory at RPC. So a market-leading law firm delivering business-critical legal advice, and Gavin represents the clients throughout the criminal investigation and prosecution process, including inquests and public inquiries. And Gavin's going to be talking to us primarily around risk assessments, the approach there, and mental health as well. Welcome. Welcome, Gavin. I'll give you we'll do an audio check. You're there?
Hi, Darren. Yeah, hi. Good. Thanks.
Great. Anything else you want to add into your bio, or is that enough to cover it?
No, I think that says it all. I tend to most of my experience in health and safety tends to be at the problem end. So when things go wrong, and so maybe you'll see a little bit of my talk tends to be a bit more about that. But I think that sort of says it all. Right? What I do.
Great. And we have Rob. So good morning, Rob, and welcome. Rob is a senior associate at Squire Patton Boggs. Rob focuses on environmental safety and health team in the international law and specialises in issues relating to facilities management, asbestos, fire safety, and contaminated land and waste. And Rob is going to be talking to us about vacant building issues and some of the government guidance and changes around that as we go through that. So, Rob, welcome.
Yeah, thanks very much. Just wanted to pick up on that. I think I probably compliment Gavin really well there, because whereas he gets involved when things have gone wrong, I try to stop things from going wrong in the first place. So hopefully a bit of yin and yang there.
Excellent, excellent. Well, it's always good to have yin and yang on the panel and a little bit of both sides of the coin as we talk about the various topics. Okay, so listen, we're going to jump straight in, guys. And like we said, if there's any questions, we won't interrupt the flow of the slides, but at each section, we'll go through and just maybe give a quick summary around what they are. And there's a slide about me. I'm CEO of Engage EHS, and I will be just sharing the meeting with the two panel experts. Okay, so the key things we are going to focus on today, like we said, we're going to talk about COVID-19 risk assessments and risk assessments in general, sort of post-COVID. Mental health, government guidance, and the vacant building issues that have kind of arisen because of the pandemic as well. So they're kind of the four key topics. Each of our speakers has kind of picked two that they're going to focus on. Like I said, we're going to be getting feedback from both around each of those as we go through. So, Gavin, we might start with you, and we're going to start off with the risk assessments and your thoughts on that.
Yeah, I thought we're putting this in the context of the evolution of health and safety legislation post COVID-19, and I thought we might just go back a bit before we talk about that, and go back to the time of Watergate and flared trousers in 1974, and back to the Health and Safety at Work Act in Section 2 and Section 3, because that is the legislation that still underpins all of the kind of health and safety activity in this country, really. And as we know, under that legislation, Section 2, Section 3, we have to ensure the health and safety of our employees and third parties so far as reasonably practical. And you'll also be aware that once a material risk has been identified, we have to do everything reasonably practical to reduce that risk, and that impacts on our duties of risk assessment. Mm-hmm. So, and there's a reverse burden of proof. I mean, if you end up in court, you're going to be the one to have to prove that you've done everything reasonably practical. And it's fair that that actually the use of Section 2 and Section 3 in relation to this sort of public health problem has been a subject of some criticism. Some people feel that it's sort of shoehorning health and safety legislation into a situation where it shouldn't go. But those lawyers tend to be much cleverer than me, so I'll leave that to one side. But it is being used. Section 2 and Section 3 are being used by the HSE as the basis of their enforcement activity so far. Mm-hmm. And as I said, it is the risk assessment, which is the cornerstone of making sure that we do what we need to do to eliminate and reduce the risks to a tolerable level. And as is well known, Regulation 3 of the Management and Health and Safety at Work regulations require every employer to make a suitable, sufficient risk assessment of the risks to the health and safety of his employees to which they're exposed at work, and the risk of health and safety of people who are not in his employment in connection with his undertaking. So far so good. This is all pretty kind of ABC health and safety law. But obviously with COVID coming along, you are under a duty under the Management of Health and Safety at Work regs to review your risk assessment if you have reason to suspect that it's no longer valid or there's been no significant change to the matters which it relates. And if you were any doubt as to whether COVID was such a circumstance, then you had the benefit of all the guidance that has been given to us by the government about about COVID and about being secure.
Hmm.
And the original guidance published back in May, and which has been regularly updated, started off with 8 sectors, and it's now 14. And the guidance given by the HSE, the Working Safely During the Coronavirus Outbreak, a short guide, a rippingly good read, I'm sure you agree, if you've had a chance to read it, which I'm sure most of you had. And what has been required is, that a lot of that guidance is about to be presumably overtaken by events, and as we know, things have just changed again as a result of Boris's announcement. Now, under the Working Safely During the Coronavirus Outbreak, that short piece of guidance, you're obliged to identify the work activity in situations which might cause transmission of the virus, think about who could be at risk, decide how likely that a person is to be exposed, and act to remove that activity or situation, or if that is impossible, control the risk. Now, I think the point that I wanted to make really, that, as I said, is that the courts tend to judge reasonable practicability according to relevant regulatory guidance. And that's usually the guidance issued by the HSE or by industry or industry practice. So a company that doesn't comply with that guidance is in serious risk of being found by a court not to have done everything reasonably practicable. And therefore, although the guidance has the look of not being prescriptive, the effect of the case law suggests that it probably is. And to go back to we were talking, the suggestion that we have to consider is how health and safety legislation has evolved. I mean, we haven't seen a huge amount of what I would call proper health and safety legislation. There's nothing new regulations related to activities at work as such, out of either the Health and Safety Work Act or regulations made under that act. But what has changed is the guidance, and the guidance has obviously evolved and is changing, and is no doubt going to be changing again. And an organisation who fails to follow the guidance by the government or the HSE without good reason could be found not to have done everything reasonably practical to protect their employees and others, and therefore that is an issue that companies need to think about. That the guidance that you are seeing and taking account of the guidance is extremely important. And I suppose it's a bit surprising that in some ways that that it took the HSE a bit of time to produce a sort of template risk assessment. The HSE in Northern Ireland produced one in April, and the HSE in England didn't produce one until July. And slightly interesting development as well, which is sort of a bit unusual and slightly different to what has gone before, is that the suggestion that companies should publish the results of their risk assessments, and the expectation that if you have a company with over 50 employees, that you're expected to post that on your website. And I mean, you obviously have to share it with your employees, but the idea of putting it on your website and basically advertising it externally is something which is relatively new, and that you do have to do that. I mean, I'm sure many of you will have come across the Modern Slavery Act, and you have to publish your human slavery and trafficking statement on your website if your turnover is over, I think it's 36 million. And so, but in health and safety terms, this is a bit unusual as far as I know. And that sort of creates two schools of thought. I've heard people say, well, it's not compulsory. And so, I'm not sure I want to do that because, it's a bit of a hostage to fortune. And others who think, well, it's a responsible thing to do. And the first thing that the HSE are going to do is going to see whether a company puts it on their website, and whether that indicates a sort of level of responsibility and an appropriate approach to health and safety. So that's a very interesting approach as well.
And is that something very good? I don't want to jump in across, but is that something you're seeing happen? Are you seeing companies kind of publish those risk assessments?
Yes, I am. Yeah.
So like you're seeing operationally, you're seeing that happen in the workplace as well.
Yeah, I mean, as I said, there are definitely two schools of thought. I think there are some people who don't think it's a great idea, but actually, I think I've certainly seen companies putting it on their websites, and as I said, I think my approach, I think, would be to do that. If we could just go to the next slide.
Mm-hmm. And we might throw a poll up. I think Laura was just nodding there to ask, what are you guys seeing? So out in the listener audience, are you publishing your risk assessments out there? Are you seeing that happen? So maybe we might get some feedback around that, as well as some intervention sort of insights around the HSE that I think Gavin had a question around. So we're going to publish those polls now in a few minutes.
Yeah. Now, the safety representatives and safety committee regulations and the health and safety consultation employees regulations, which basically require you to consult with your workforce about anything that's substantial that's going to affect their health and safety, is not new legislation. But I think it's really pushed it to the front of the queue, because certainly there are organisations that I've spoken to who hadn't really looked at this, and it's been a very important part, and I think it's a very key consideration. The area of communication in general, I think, around changes in risk assessments, changes in working practice, is absolutely key to successfully navigating your way through this whole crisis. And as you see, the regulations require you to consult basically with your employees. If you have trade union, recognised trade union reps, then you do that under the 77 regulations. If you don't, then usually you go direct to the employees, or they would appoint safety representatives. But basically, you need to consult with your employees about significant changes. And I think those companies that do that, make it much easier for themselves generally long term. And part of the reason I say that is because, as we'll see in a little while, that where there have been enforcement issues, where the HSE have gone into businesses and issued guidance or notices of contravention or enforcement notices, it's often been as a result of whistleblowing by employees who feel that the company has not done enough. And so, in my humble opinion, I think it is really important that companies do communicate with their employees about what they're doing, what they're trying to do, and that is not a one-way traffic. That is a dialogue between the company and its employees. And I think by doing that, you get engagement, you get discussion, and the people at the sharp end, can see where the problems may happen, and they can really feed in properly to the risk assessment. So I think that is really, really important.
Yeah, it's a very valuable point. Yeah, absolutely.
Now, I just wanted to talk very briefly about how successful companies have been with their risk assessments and putting in place control measures. Now, the HSE has identified the sort of four major issues that they're seeing. And none of these are rocket science. I mean, these are, pretty front-on issues, very, very front and center with the risk assessments. And they are basically failing to provide arrangements for supervising, maintaining social distancing. And social distancing is obviously, a central tenet of the guidance that we received. Mm-hmm. A failure to introduce an adequate cleaning regime, particularly at busy times of the day. And then failure to access welfare facilities to allow employees to frequently wash their hands with warm water. And so, I mean, it's pretty basic stuff. Yeah. And then finally, failing to manage contractors who come onto the workplace. And again, I think that probably is a lot about, communication with contractors, letting them know how, where the pinch points are in the business and so on, and keeping them informed, making it clear to them, where they can go and where they can't go, and those sorts of things.
Yeah.
So I think those are the issues that the HSE have identified as being, particular problem areas where they're seeing, companies not complying, not keeping their premises so-called COVID secure. And then in enforcement, the HSE issued some, or has said in a number of communications, some letters and so on, that their regulatory approach is going to be proportionate to take account of the risks and challenges arising from the pandemic. And the reason they say that, or at least one of the things the HSE has said, that the reason that they've taken this proportionate application is because in terms of personal health outcomes for an infected worker, the consequence of the infection is not normally serious. And none of the guidelines on COVID risk controls in the workplace have a statutory status. Now, well, I mean, that may change, I think, because, obviously we're getting to know a bit more about COVID-19 as it goes on, and whether it's still true to say that it doesn't have a personal outcome for an infected worker. We'll see as time goes on. That may change. Yeah. I'm not a medic, so I don't know. But certainly the way that they sort of set this up is that when they're dealing with social distancing and measures to control the risk of transmission, the most common action by them is to give verbal advice or to write a formal enforcement letter. And I think that is the reason they're doing it. They're trying to take it, we're in a difficult situation. There's a lot of guidance out there. I think the HSE are taking an approach where, they're not going in prosecuting people very, as so far.
Yeah.
Now, obviously, they have they are issuing advice, some verbal advice. They're also going in and writing letters to companies who they feel have not made their premises COVID secure. And I sort of quite interestingly, one of those letters which received a considerable amount of publicity was a letter that was written. I described it about the Kremlin, and the HSE's purview has not yet reached Moscow, but the Kremlin is the name given to the DWP's office in Leeds, Quarry House. I believe because of the architecture rather than for any other reason. And obviously it's very interesting that that office was one of the first. Or not necessarily the first, but certainly the one that received considerable publicity when the HSE wrote to them identifying problems within that office. And obviously it's an interesting choice by the HSE to have done that to the DWP, because of course the HSE is sponsored by the Department of Work and Pensions. So that was quite an entertaining step. But the notice of contravention there was brought about by whistleblowing. There were people who were not happy about what was going on in those premises. The notice of contravention was predominantly about social distancing, and the breaches were under Section 2 and Section 3 of the Health and Safety at Work Act. So, as I said, the cornerstone is this is not new legislation. You're using the old legislation, the legislation that's been there for years as the basis for the enforcement. And the stuff that they were finding was walkways being too close to desks where the walkways were looking to be usable, coat stands too close to desks, stairwells designated for two-way traffic not being sufficiently wide for two people and to keep 2 meters apart. A line manager giving instructions to people and being too close to him when he was doing that, and desks and pods which were not being used, not being marked as something that should not be used. There was no tape, no signs, nothing to show maximum occupancy of rooms and those sorts of things. So it's quite a detailed list of things. I think if I was in the business of boundary tape, that very nice orange and black tape that you see everywhere, that would be the business to be invested in at the moment. I think. Yeah, it's sort of certainly the use of that seems to be something that the HSE like. And as I said, the two the two things that come out of that is, as I say, whistleblower and the breach of Section 2 and Section 3 using existing legislation. And I saw another notice of contravention letter recently, which was given to a laboratory, and again it was the same things. It was Section 2, Section 3. There was also a suggestion of a breach of Regulation 3 as well, because of the risk assessment, and also because of the communication that hadn't taken place. I go back to the point I made at the start about communication with staff being so important. There had been a little bit of consultation with some of the people in the business, but that had left out rafts of people in the business who the health and safety executive felt that who would have had good input and would have helped them avoid certain issues. So it was communication with staff. It's basically use of Section 2 and Section 3 again, and Regulation 3, and then again it was to do with whistleblower who said, there's things here that aren't right. So as I said, I think communication comes out of this very strongly. So those are notices of contravention that have been used, combined with obviously fee for intervention. The enforcement notices are also being used. I had a look on the HSE database yesterday, because that's I don't get out enough like everybody else, and on that, just putting in the English enforcement notices, putting the words sort of COVID-19, there seem to be around 56 hits for that. Some of those were extensions, I think, but so there were about 20, 30 maybe individual companies who'd received improvement notices. So I haven't seen any prohibition notices by the HSE. I couldn't find them. Maybe some of our audience may be able to say differently. And
yeah, we might watch a poll actually on that. I think Laura's going to put something up there in the next couple of minutes around that as well.
Yeah, and obviously there is some delay on that. I mean, anybody who's ever tried to use that database knows how much fun it is, and that each time you put something into it, you get a different answer. So it's not the most easy database to use, but and also, then things don't go on there for some time sometimes, because obviously they have to allow for a period of time for any appeal, and also it's limited because you won't get the enforcement notices that have been issued by local authorities. And obviously there's a large area of enforcement and area of businesses which are going to be enforced by local authorities. And just finally on prosecutions, I haven't heard, and again, maybe somebody else can tell me different, that there have been any prosecutions or under Section 2, Section 3, or any other kind of health and safety regulation. I mean, obviously there are, we're hearing of businesses who are closed down. What I'm not sure about is whether those are being done under health and safety legislation or public health legislation. Yeah. There were businesses, and also whether businesses have closed down because of, voluntarily, because obviously if you have an outbreak, then which is more than 2 people being diagnosed with COVID-19, then you have to speak to public health, and usually that will, if there is a significant outbreak, as we've seen with some of these factories around the country, then usually there's, what I've seen has been voluntary, that the factory's been closed down for a period of time to allow deep cleaning and so on. Yeah. So yeah, that was what I was. Those are the sort of points I wanted to bring out in relation to risk assessment and the sort of evolution of the legislation, or the non-evolution.
And I think Laura's just launching a poll there at the minute, just to kind of get some feedback around what the audience has seen in relation to enforcement in relation to improvement notices or any potential prosecutions as well. So we'll try and get some audience participation on that. I think on one hand, one of the things I took away is it's very good to see that the HSE can work independently and actually go after the Department of Works and Pensions as well, and not actually be in fear of funding within that as well. So at least it gives you some sense of authority and independence as well. Rob, I mean, do you have any thoughts to bring in on that, Rob, in relation to kind of the approach to risk assessments, what you've seen, any changes or any differences?
Yeah, I mean, I'd be really interested. I don't know if we could do another quick poll at some point, but Gavin mentioned the point on consultation, and my experience has been that companies have been fairly good at coming up with risk assessments, producing risk assessments, and very good at putting in place control measures which reflect the government guidance. But one area of particular weakness that I've noticed, just in my own personal experience, is that companies have been not particularly well organised in terms of consulting with their workforce. And I'd just be interested to know whether what the experience of the attendees has been, whether or not they've been consulting, whether or not their employers have been consulting with employees on risk assessments and control measures which have been put in place. But I agree with everything that Gavin said. I mean, the fundamentals of health and safety law really haven't changed that much at all. As he said, Section 2 and Section 3 is still there, and it's being effectively almost in a sense crowbarred to adapt it to being used for the fight against COVID. Management regulations, Regulation 3 and Regulation 5, they're still there. Absolutely. One point which I think it's worth picking on, though, is Section 7 of the Health and Safety at Work Act 1974. So that's the duty on employees to take reasonable steps to safeguard their own health and safety, and also that of their co-workers as well, and also to cooperate with their employers on health and safety matters. And I think that's really important, because it's not just one-way traffic here. There are reciprocal duties, and I think that's important to sort of demonstrate almost a spirit of partnership between the employer and the employee. That, to coin a phrase, we're all in this together. And employers have got the duties to take steps to reduce the risk so far as reasonably practicable from COVID. But there's also a duty on the employees as well to cooperate. And I think that's really important, because and it goes back to what Gavin was saying about consultation as well, because we talk a lot in health and safety about leadership, health and safety leadership, and I think that consultation is really such a fundamental way of getting in contact with the stakeholders, and to really get people on board here, and to get leadership, and in a sense to get sort of workplace champions, if you like, people who will lead by example. Because it's very tempting to, especially at the start of the pandemic, people might sort of skimp on using hand gel, or might not necessarily socially distance. And I think you need people in the workplace who are prepared to lead by example, and who will observe the rules and requirements, because that does rub off on the rest of the employees. So I think consultation and bringing people on board is really, really important from that perspective. Just in addition to health and safety law, which is continuing, we've also got public health regulations which relate specifically to coronavirus. So we've almost, in a sense, got sort of two parallel streams of law going on at the moment. You've got the coronavirus regulations, which specifically relate to coronavirus and COVID-19, and then you've got in the background the health and safety law, which hasn't changed, which applies to all health and safety, but it will also cover coronavirus and COVID-19 as well. And you can have there, as I say, there's a certain amount of overlap between the regulations. So, for example, in the self-isolation, the COVID self-isolation regulations, which were introduced a couple of months ago. So it's unlawful for an employee who has been notified that they've been in close contact with somebody with COVID-19 or have COVID-19 to go into the workplace. Well, yeah, and that would be a criminal offence under the self-isolation regulations. And it could also potentially be a breach of Section 7 of the 74 Act as well. Likewise, Regulation 7 of the self-isolation regulations, it's now unlawful for an employer to require an employee who they know is required to self-isolate to come into the workplace. Well, again, that's a criminal offence under the self-isolation regulations, but it could also be a breach of Section 2 and Section 3 as well. So there's overlap there between the two, and I think that's really interesting because at some point, I guess when the pandemic is over, the coronavirus regulations will hopefully fade away into the background, but clearly the Health and Safety at Work Act will continue.
Remain. Yeah, no, I think very interesting points.
Sorry, there was just one. I'm just going to say, just add to what Rob was saying. I mean, absolutely right. I mean, the self-isolation regulations. And the fact that an employer has a duty to not to require employees to come to work, that part that does, there's an aspect of that, for example, where company directors and so on can be made if they can consent, neglect or connive in an offence, can also find themselves in trouble. So that has a look of kind of health and safety legislation. It has a kind of feel of it of health and safety legislation, although it is public health legislation in effect. So I agree with Rob. I mean, it is, we have these sort of two kind of things going side by side, and it's a very interesting time.
Oh, great. And I suppose we might just touch on our polls real quickly while we're there, as they're kind of closing off. So what we've kind of seen, if we go in order of issued, is your business publishing their COVID-19 risk assessments online? So it's kind of split across that. We've got 44% saying yes, we've got 50% saying no, and then the other 6% don't know. So yeah, quite a split across that. Obviously 50-50 more or less across yes or no. The interventions, have we seen any sort of change in interventions from the authorities? So 34% are saying visits, they've seen increased visits. Very few, just one person is saying they've seen improvement notices being issued, but the majority are saying nothing different so far. So no change for the most businesses, most people. And then the final one that we kind of threw out there was, have you engaged with your employees while creating COVID-19 risk assessments? I think two very valid points from both of you around the engagement and collaboration with employees. Obviously, it's always hugely important about driving the correct culture and how you actually engage your employees. So, overwhelmingly yes across that. So it's 88% said yes, they have engaged with the employees while creating the new risk assessments and control measures. And then no and I don't know, very small percentages. So some interesting stats in there. Any thoughts on any of those that jump out at you guys?
Well, I guess as far as the publishing of the risk assessment or the results of the risk assessment on the website, obviously the suggestion is for companies over 50%.
Yes.
It was expected. So that might explain why some haven't, I suppose. That's
yeah. And maybe a worse would be that if you are over 50 employees and you're in the no category, perhaps think about getting it up on your website.
Absolutely.
Very good. Okay, so we might move on to the next topic then, Gavin, if we can, on mental health.
Yeah, I'm going to deal with this quite briefly. I mean, it's as we know, Mr. Twain described it very well, that there lies statistics, and here we have some statistics, and the stress, depression, and anxiety is the most commonly reported cause of work-related ill health in Great Britain. And I think the number of work days is lost to these things is actually the highest. Almost 1 in 5 UK adults felt hopeless as lockdown began to ease, according to the Mental Health Foundation research. And mental distress was 8.1% higher in April 2020 than it was in 2017 and 19. And then over 30% of adults reported levels of mental distress indicative of treatment being needed in April 2020. Which is a fairly kind of significant figure, and I think as I said, there are other statistics I'm sure that are out there which saying some people are enjoying, certainly the working at home. That is the sort of, has been a double-edged sword. I personally, as I was saying to you, Dara, before we came on air, was that the sort of novelty has worn off of working at home in my experience. But on the other hand, there's been some real upside. I find that I like my family, having spent some time with them. Whether they feel the same, I don't know. But there is definitely, there are some upsides as well, and so I don't think it's all one way. But there is no question that there is there are significant impacts from COVID-19, and whether it's working from home or whether it's just people's general anxiety about COVID-19. And then this is another statistic. I'm very sorry about this. I got a bit carried away. And this is from the Office of National Statistics on the 30th of October. And it said the proportion of working adults in England working from home in the last week was higher amongst those living in Tier 2, which was 46%, and Tier 3, 42%, than it was in Tier 1, which is 37%. And I mean that, so it looks around, around sort of 50-ish, getting on for 50% of people are working from home, and at least, a part of the time. And obviously, with Boris's announcement and the new kind of guidelines coming out, there may well be more that will be going up. We can expect that to go up. And the HSE have recognised, the problems created by COVID-19, and they included it in their template risk assessment. So the risk assessment that came out in July has a chunk about mental health. And so, a big issue of this will be people working at home, and the HSE defines lone workers who work by themselves without close direct supervision. So, that will be people working at home. As I said, in the template risk assessment, hazard identified in that risk assessment is the risk to mental health and well-being through isolation or anxiety about coronavirus. And that doesn't necessarily, that is not just home workers, that's everybody potentially, but it's but obviously the potential damage to people living at home, who feel isolated and so on, is definitely there. And the guidance protecting lone workers, I think it was updated in March, which is probably about the right time. And in that it says that lone working, can negatively impact an employee's work-related stress levels and their mental health generally. And they point to the stress management standards, which include factors such as relationships, support from other workers and managers. And if they're not managed properly, that can lead to work-related stress issues. And being away from managers could mean that support is difficult to achieve. I mean, certainly, even within our organisation, if you have people coming in when everybody's working from home, do they feel that they have as much support as they would, if we were all still back in the office, for example? It must be quite difficult. I mean, I've been at my firm for 33 years, so it's quite difficult for me to imagine what it would be like to be starting a new job, but starting a new job where the rest of your team is working remotely, and you can't just pop your head up over the parapet and say to somebody, how do I do this? And certainly you can't keep Zooming people or calling them 15 times a day. Yeah. And that supervision and all of that, people feeling alone, I think is definitely, something that lots of organizations are going to have to grapple with. So putting in procedures, the Protecting Lone Workers suggests putting in procedures allowing direct contact between home workers and managers is going to help with that. We all know that that's definitely not perfect, but managing work-related stress relies on really understanding what the normal behaviours are of the people that you work with if you're a manager, understanding how do they behave normally, and recognizing when they're a bit different. I think it's the sort of somebody's naturally very outgoing, chatty person. If we suddenly find they're becoming more introspective, is there something there?
Yeah.
And recognizing the symptoms at an early point. And if contact is poor, then that can lead to employees feeling disconnected or isolated or abandoned, and can affect their performance and their stress levels and their mental health. And so the risk template that's the HSE identify, and there is a stack of guidance on the HSE's website about managing mental health, but the sorts of control measures that they're suggesting are having regular meetings or calls with people to talk about work issues, talking openly about the possibility that they may be affected and telling them what to do and who to raise it with, involving workers in completing risk assessments, going back to that again, so they can identify problems and solutions, keeping workers up to date so they can be involved and reassured, discussion of fatigue with employees and making sure they take regular breaks and encouraged to leave and set working hours to ensure they're not working too long hours. And I think, speaking again personally, I think that is very difficult. When you're at home, the computer is always there, or it can be. You don't have that natural decompression when you commute to work in the morning and when you come back in the evening, and that time, right, I'm now leaving work and I'm going home. That natural break isn't there. And I think that is something that people struggle with. I certainly feel I struggle with that myself. Sharing information, advice on mental health and well-being. So obviously, most organisations have some, give some advice on mental health and well-being. Have outsiders coming in and talking to people about how they can keep their mental health well. Consider an occupational health referral if personal stress and anxiety issues are identified, and if there is a employee assistance program, then encouraging workers to use it. And those are the kind of, obviously there are the management standards. It has the sort of 6 areas which tend to lead to, or the six sort of danger areas for mental health, and so the risk assessment refers to those. I was just going to talk briefly about enforcement because, as I said, I tend to be more at the cock-up end of things than at the at the advisory end. But the mental health hasn't been a sort of traditional area of enforcement by the HSE. It's certainly become more important. I think when they were putting together their priorities for sort of pre-COVID, certainly, they were shifting. It was the health and safety executive had always sort of perhaps spent more time on the safety than they had on the health, and there was a feeling that they were going to look at mental health and the fact that there was a lot of work-related stress around. But it hasn't been an area where we've seen really much enforcement. And there's a couple of things. There was a letter to a select committee, the Work and Pension Select Committee, I think back in April, and then recent guidance in relation to how to report a work-related stress concern, which sort of gives an indication about how the HSE are going to approach it, where they say that they can't really investigate individual cases of work-related stress because it's subjective. So something that affects one particular worker will not have ill effects on another. So that may be due because the person has a pre-existing condition, and it makes a person more susceptible to stress. So it seems, and this is sort of reading between the lines, but it certainly, there's stuff out there which is saying this, that they're going to concentrate their efforts in ensuring the employers have in place suitable and sufficient risk assessments, apply it, and have in place interventions to tackle identified stresses. And where they might investigate is where there's an indication of an organisational or systemic problem, e.g., if there were a number of staff who were suffering work-related stress, that might indicate that there was a systemic issue which would be necessary to investigate. But generally, as I say, it isn't an area where the HSE have really, as far as I'm aware, and again, if anybody knows better than me, then I would be fascinated to hear. But as far as I'm concerned, I don't know of any improvement notices or even letters of advice that are out there, and certainly no prosecutions around failing to ensure people's mental health.
Yeah, I mean, so other than paperwork exercises and looking at systems that you have in place, it's probably hard to imagine how they would go about some of that enforcement as well. It's a difficult one to really actively enforce through an organisation, right?
I mean, there was a case. I think it was Renown quite recently, which I've seen referred to as being a kind of move towards it, but that was more to do with worker fatigue. And it was actually a case where there was a road accident as a result of somebody who'd been working long hours and had been involved in a road accident as a result of being tired. So, you could say that is a move towards people's health rather than safety, but it's not how I would. It's a bit different from a situation where you're saying, it's related to people's workload or something where it's coming, where there's a direct correlation, if you like. So. Yeah, I'd be interested to hear if anybody's got.
Absolutely, Rob. Do you want to come in on any of those points?
Yeah, I mean, I agree. I'm not aware of any prosecutions on the mental health side in the UK, but of course, in France, at the end of last year, we had the France Telecom prosecution, where 3 senior executives at France Telecom were convicted after. I think it was 35 employees committed suicide during the 2000s, and they managed to find the causal nexus, which I think is the real difficulty between those suicides and the actions or inactions of the executives. So perhaps that's a sign of things to come, maybe. I mean, I see that the focus on mental health at the moment is a continuation of a trend. I mean, we're talking here about the evolution of health and safety. And if you cast your minds back to 2016, the HSE published some statistics which showed the UK as having, I think it was the second lowest rate of fatal accidents in the workplace within the European Union. I think we were just behind Cyprus, who weren't reporting any fatal accidents in the workplace. But that sort of gives the suggestion that in the UK, and I think Gavin has alluded to this, that we think that we do physical safety fairly well, and therefore it's time to maybe turn our attention more towards health, welfare, and within health and welfare comes the mental health side as well. And you might recall that again in 2016, the HSE published its 5-year strategy, which was helping Great Britain work well. And one of the tenets for that was tackling work-related ill health. Now, clearly they had in mind principally things like occupational cancer and asthma and things like that. But clearly over the course of the pandemic, mental health issues have been brought more and more to the fore. So I see this as a continuation of a trend which was already there, and I don't think that we're going to see that abate. I think it's going to continue.
Yeah, no, good point. I think, just touching on some of the things earlier, I know that in terms of people's workloads and the current situation, I think there's definitely signs that people are working longer hours. I think some of the surveys I've seen and talked about kind of between 20 and 25% in terms of additional working hours, which it's just hard to switch off. It's hard to turn off. It's hard to find space to do that when you're working and sleeping and eating and playing and minding kids and everything else in the one space. So it's a difficult task for a lot of people to face. But I think, as you said, we'll see a lot of evolution maybe and focus on that coming out of this, perhaps with that change in work practices and change in focus. Very good. Okay, so look, what we might do then is move on to maybe one of the topics you're going to focus on to start with, which is the vacant buildings and COVID-19, and where that kind of brings us to the minute.
Yeah, sure. So thanks for that. And Gavin has already touched on the fact that he hasn't been back into the office much, if at all, since lockdown started in March. And I'd be really interested to know, and I've suggested that we do a straw poll on this to work out, or to hear from the attendees of the attendees, once the lockdown and the pandemic has ended, who anticipates going back into the office as they were in pre-lockdown levels, who is intending to spend most, if not all, of their time working from home, and who is minded to probably take on more of an even split between the two. So I don't know if we could have a quick poll on that, but
yeah, we've just launched that poll. I'm just voting now myself, so I'm going for a blend of on-site and work from home in the future.
And I think that would be really, really popular as well. I mean, yes, I mean, one of my particular areas of specialism is environmental and health and safety issues associated with the management of buildings. And that's been top of the list of many employers over the last 8 months or so. So following the government's announcement on Saturday evening, a lot of workplaces are going to be required to shut again from this Thursday in England. So those include all non-essential retail, restaurants, pubs and bars, cinemas, hair salons, those sorts of things. And there are effectively two sides to this. There's the actual locking down, which is problematic in itself. And then you've got the reopening, which anecdotally I've heard is even more problematic. So if we think, to start off with, thinking about locking down, and there are lots of fairly obvious issues, I think, associated with locking down, because if you're locking down quickly, if you're closing down premises or venues, you're going to have to take suitable arrangements for really simple housekeeping things, like, for example, disposal of waste within the building, especially any waste which may putrefy or may attract vermin, so that you don't get into hot water with the local EHO. Consider whether also arrangements to stop thieves or vandals or other trespassers from obtaining access to the premises if they are going to be fully shut during lockdown. Consider taking steps to mitigate any obvious risks. So, for example, if you're operating pub premises or a bar or something like that, closing cellar doors, making sure that they're secured. Now, you might think, well, actually, if a trespasser or if a thief were to break into my premises while they're closed, then I don't care what happens to them and let them break their neck. But there is the potential for them to be liable under the Occupiers Liability Act. So it is worth taking steps to mitigate any risks that trespassers may find themselves in. Consider what you're going to be doing in terms of CCTV monitoring. Are you going to continue monitoring the CCTV while the premises are shut? Who's going to be doing that? Can you do it remotely? If there are burglar and fire alarms, again, what sort of systems, what sort of mechanisms are you going to have in place to monitor them if they are activated? Are local key management going to be notified if the alarms go off? Are the local emergency services going to be contacted? So there's some really sort of practical issues that people need to think about. If you're going to be if premises are going to be fully shut down during lockdown, what arrangements are you going to have in place to visit them from time to time, to check on the condition, to check on whether or not there's been any vandalism, and to check on security? And as part of that checking process, consider assessing the risk to the people who are going to be carrying out that checking process, because likely they may be working alone. Are they going to need torches? Are they going to need mobile telephones to contact people if they do get into any spots of bother while they're there? We've touched on risk assessment before, but you will need to update your risk assessment. The risk profile of your premises during periods of lockdown will change. There are going to be fewer people there, sure. but are there going to be other increased risks? So, for example, if you've got any CO2 canisters or any other sorts of hazardous substances there which get regularly checked, who's going to check them? So the risk assessment will need to be updated. And one of the things that I'm very keen on is that, and I'm sure that our attendees will be sympathetic to this, is that risk assessments aren't seen as being static documents. They should be organic, living documents which are updated from time to time depending on changes of circumstances. So health and safety risk assessments should be updated. Ditto fire risk assessments need to be updated during the lockdown because the risk profile will change. There are going to be fewer people present, so that risk will be reduced, but is the likelihood of fire being detected also going to be reduced because there are fewer people around to spot a fire if it were to be caused? If you've got retail or hospitality premises, so for example, if you run a bar or a pub, is anybody living above the premises? So do you need to give any consideration to those people who are living above? What sort of arrangements will they have, say for example, for safe escape in the event of a fire? Now, a lot of premises won't be shutting down entirely, and some premises will be maintained with a skeleton staff on site who can't work effectively from home. So I think employers have got to consider what about the arrangements for those skeletal staff? Are they going to be able to work in the workplace safely? Are there going to be adequate arrangements in place for them? Is there going to be, say, for example, adequate first aid? Is there going to be adequate access to a trained first aider there? Are they going to have access to work equipment, safe work equipment? Are they going to be able to wash their hands with soap and hand gel? Is somebody going to be maintaining the stocks? So it's the logistical exercise in as much as anything else which needs to be considered here. But also insurance as well. I mean, if you are closing down the premises or if you're going to have fewer people present, do you have to check the terms of your insurance policy? Are you going to have to notify who your insurers are of that fact? Now, I think that a lot of people who are listening to this will be well practiced in this because we've already gone through a comprehensive lockdown once. But it's worth rehearsing those sort of caveats. But again, having lockdown, sometimes coming out of lockdown, as I mentioned before, can be as tricky, if not trickier. So, having already looked at your risk assessments once when you've gone into lockdown, when you come out of lockdown, you're going to have to look at them again. Are there any particular issues that you need to consider there? So, for example, have you got any M&E, mechanical and electrical and electronic plants, which is present? And are those going to have to be inspected? If they've been out of service for some time, do they need to be looked at by an engineer? You know, how far past the date for a thorough inspection are they? For a thorough examination, rather. Consider things like Legionella as well. I mean, if your water system within your building hasn't been used, if it hasn't been turned over for a period of time, is it worth considering a Legionella test there? Consider as well HVAC, so your heating, ventilation, and air conditioning system as well. Is that going to be working? The government guidance is very clear that ventilation is one of the control measures that employers should be adopting to reduce the risk from the spread of coronavirus. So, what arrangements are you going to have in place for adequate ventilation? Is the ventilation system still working? And as we go into the winter months, of course, the heating also needs to be working as well. So these are other things, because the welfare regulations haven't gone away; they are still there. People have to work in comfort, especially during the winter months as well. So these sorts of issues need to be considered. Again, your fire and your smoke detection systems, checking that they are fully operational as well. And a lot of employers will be considering again, do we need to carry out a deep clean before we reopen the premises as well? Not just to rid any potential bacteria, but also build up of dust as well, which can accumulate if premises aren't occupied fully or at all for a period of time. And during that deep clean, again, consider what protection measures are going to be in place for cleaners. Are they going to be adequately supervised? Are they going to have access to safe products? Do they need a cost risk assessments for any cleaning products that they're using? And what about PPE as well? Are they going to require any PPE? And how are you going to source the PPE if they need it? Because clearly there are quite a few demands on PPE at the moment. So those are the sort of the general sort of considerations that certainly over the last few months or so I've been discussing with our clients, and I don't know if anybody else has got any comments on those.
Oh, very interesting. I think just before we go over to Gavin, I think a couple of things. Obviously here I'm based in the Dublin office in Ireland, and we've gone into a second lockdown already. And the one thing I've definitely noticed here is that there's a slightly different approach to the second lockdown in terms of what people are considering, must work from home or can work from the, so there's definitely a shift in terms of what's essential retail. It's clearly defined, but there's definitely some peripheral kind of pushing of boundaries to go, yeah, we'll stay open. Some of that's being enforced, some of that's being pushed, and there's kind of some policing of that. But certainly when we talk to maybe some of our customers and looking at the general take of things, whereas in the first lockdown you had a lot of manufacturing just stopping, now there's an intent of, no, look, we do need to keep things moving here. We need to keep, and again, for a lot of those reasons, for maintenance reasons, the cost of shutdown and reopening of manufacturing plants hugely costly. So I think there's an element of, if we can keep skeleton staff going and keep processes going, albeit reduced, they'll certainly do that, and we're certainly seeing that over here. And I presume it'll be the same, across the UK as well. Gavin, any thoughts on some of the points there from Rob?
Well, just a couple of things. I mean, I absolutely agree. A lot of my work comes from insurance companies, and the point that Rob made about insurance. I mean, it is definitely, if the property is going to be unoccupied, then that is actually key, because most policies will change if the property does become unoccupied for any period of time, as with your household property. And it's a bit like working from home. It's always a good idea to tell your insurer that you're working from home as well. The other thing is that obviously if the property is going to be completely unoccupied, or indeed if you're going to send somebody in on a regular basis, that person may be a lone worker. So you might want to, check the position insofar as their risk assessment. If they go in there and have an accident, what happens then? Is somebody going to know that they've gone in, they're checking the property or whatever? But if they fall down the stairs or something happens, is there a check-in procedure for that? So I think that's another thing we're thinking about. And the other thing is just the state of the property itself. I think Rob touched upon this, but I've certainly dealt with a number of cases where, things have fallen off properties, and and if a property is likely to be unoccupied for a period of time, and in that time it's in a bit of a dilapidated state. I mean, we've seen some very, very tragic cases over the years where things have blown off the roof of properties, or there's been a part of the front of the property as deteriorating, something's fallen off the property or whatever. So certainly those sort of things need to be considered if the property is an older property. It's definitely worth making sure that you've done a kind of walk around and that there's nothing there that that strong winds or anything is going to damage, because we've seen a lot of very horrible cases around those sort of things.
Yeah, really interesting. Actually, just picking up on that, Gavin, had a client who, and this was early on in lockdown, older building, was hit by a tree that fell down. Didn't do very much obvious damage, but we had one of the client's employees had a look around and discovered a fine layer of dust inside. So of course immediately they thought, oh crikey, has it disrupted some asbestos that we weren't aware of was present? But they carried out some testing, and it was wholly innocent dust. But it's something to be aware of, as you say. Things falling off buildings, things falling into buildings. They do have to be looked at and looked after, even though there may be no or fewer staff present.
Yeah. And we've got some results back from that poll as well there, Rob. So in terms of the audience, how is your business planning on conducting work in the future? Majority going back to the office or on site. We've got about 17%. Those who can continue to work from home will do so, about 20%. And then a blend of on-site and work from home, about 60%, and a couple of undecided. So we're trying, if you kind of put the two together, you're talking about 80% of the people there who will be probably commuting less or not at all in the future, or the intent to do so. And this is probably not really a safety question, but just interested actually just to get your thoughts on it. I mean, if that's indicative really of the wider public, how do we think that's going to change the fabric of towns and cities as well? I think that's probably more of a social question, but it's an interesting one that relates back to the vacant buildings. I think there could be a significant impact on what we look at in terms of the makeup of our cities as well.
Very true. Very true. That's and that ties in as well with the demise of the high street anyway, with the rise in online sales as well. So it does seem to be a bit of a perfect storm for city centres. And how are they going to adapt to that? Are we going to see more previously commercial buildings being converted for residential, perhaps to take some of the burden off the green belts? Again, a really interesting sort of sociological question there. Yeah,
I think there's I think there is an issue about as well the if we're talking about changes as a result of the way that we're working going forward, if we do end up in a situation where people are going to be working at home much more, and we've been forced to do it over the last 7 or 8 months, but if society moves to many more people working at home, it will be interesting to see how much more interventionist and how much more interested that regulators get in home working. Obviously at the moment I think it's fair enough to say that it's more the kind of exception than the rule. And so, but it hasn't been obviously over the last 7 or 8 months. We've got sort of 50% people working at home. If we're moving more to a society that's going to be more like that, and Rosper always say, don't know that the home is the most dangerous place. And to what extent are regulators going to get interested? And I think there is it is one of those difficult questions, is to the extent of how much responsibility does an employer have to take for the actual environment in which the home worker is working, and where does the home worker's own responsibility start and end? And I think that will be really interesting to see, and I'm sure that could come into stark relief in the next, if society moves to another way. Anyway.
I think that's going to be a very interesting one to watch, because again, it's not just the employer's responsibility, but then there's also that conflict of what the employee, it's my home, it's my environment that I'm in, and can we input or impact can an employer actually have on that environment as well? So
exactly.
It's going to be a difficult one to navigate, I think. Okay, great. So look, we might move on to the next topic, Rob, if we can, and just talk about maybe some of the things that you've seen around government guidance for business.
Yeah, I'm conscious that we're sort of a bit short on time here, so I won't stay too
okay.
long.
We can run a little bit over, because my fault we started late, so we can certainly run a little bit over if people are.
All right, thanks. Thanks for that then. So yes, I mean we've already sort of talked about the COVID secure guidance, which the UK government has promulgated in recent months, and we've talked about how that represents good prima facie evidence that you are, as an employer, reducing the risk to your employees and persons other than your employees as low as reasonably practicable. And it covers quite a few sort of aspects that we are, as health and safety specialists, already familiar with, things like risk assessment and consultation. But the HSE as well has adapted its advice to cope with the current pandemic. So, for example, if you look at Gavin mentioned earlier on, it's published a risk assessment template for COVID-19 as well, following in the lead of the Northern Ireland Health and Safety Executive. But not just that, it's also adapted its guidance for RIDDOR as well. So and this is it's quite an interesting section of the guidance, actually, if you have a look on the HSE website. So it identifies 3 circumstances in which an employer may be required in connection to coronavirus or COVID-19 may be required to submit a RIDDLE report. So the first one is where there's an accident or incident at work which has or could have led to a release or escape of coronavirus, and that would be reportable as a dangerous incident, as a dangerous occurrence, rather. Now, whilst the HSE's guidance states that every situation must be assessed on its own merits, the type of reporting might be more relevant in these circumstances to clinical or laboratory workplaces. So, for example, the instances that the HSE gives of situations where a release or escape would be reportable are a laboratory worker accidentally smashing a vial containing coronavirus on the floor, which leads to people being exposed, or a sample of COVID-19 from a patient breaking in transit, leading to a spillage. So I'd suggest that for the vast majority of employers, that type of reporting would probably not be applicable. As I say, it's going to be more specific to clinical and healthcare employers. The second example cited by the HSE is where a worker has been diagnosed as having contracted COVID-19, and it's attributable to an occupational exposure to coronavirus, and that's reportable as a case of disease. Now, in this case, the employer must make a judgment based on the information available as to whether or not a confirmed diagnosis of COVID-19 is likely to have been caused by occupational exposure. So in other words, the employer must be satisfied that there is reasonable evidence that on the balance of probabilities, i.e. it's more likely than not that an exposure to the virus in the workplace is the cause of the COVID-19 in the employee or in the worker. Now, it may be really difficult to conclude this, given the current prevalence of COVID-19 in the general population, especially as levels are apparently seeming to rise. But the HSE has given some further guidance on this particular reporting requirement, and they've recommended considering whether or not the general nature of a person's work activities has increased the risk of them being exposed to coronavirus. They've suggested that employers consider whether or not there was any specific identifiable incident that led to an increased risk of exposure. And they've suggested that employers consider whether or not the person's work directly brought them into contact with a known coronavirus hazard without any effective control measures. Now, that can seem a little bit daunting, and there's a lot potentially on board there for employers to consider. But the HSE has said that they don't expect employers to conduct extensive inquiries into seeking whether or not to determine whether or not a COVID-19 infection is work-related. The judgment simply has to be on the basis of the reasonable information available. And interestingly here as well, the HSE has stated that there's no requirement for RIDDLE reports to be submitted on a precautionary basis with regard to COVID-19. And we very often see that with asbestos exposure. And what they've said is that where there is no evidence to suggest that occupational exposure was likely to be a cause of the COVID-19 infection, then no report needs to be made. The third example is where a worker dies as a result of occupational exposure to coronavirus, and that's obviously reportable as a death. Similar considerations there apply for where somebody has contracted COVID-19 as a result of exposure in the workplace. But in addition, there must also be medical evidence, for example, a death certificate, that the disease was a significant contributing factor towards the person's death. So RIDDLE reporting has evolved as a result of the current pandemic, but we've also seen an evolution in the advice given in respect of DSE assessments. We've talked about working from home and the continued prevalence of that. Now, originally at the start of the pandemic, the guidance was, as it was previously, that people who work at home on a temporary basis do not need a formal DSE assessment. However, as lockdown has continued, that guidance has been, I'd say, modified, so that although no formal DSE assessment is necessarily required by the HSE, where people are working from home on a temporary basis, that employers should encourage or assist workers to carry out their own basic checklist for DSE type issues at home. So, and we're still in a circumstance at the moment where some people are working at home permanently, some people are maybe thinking about changing their arrangements. So, at what point does temporary temporary working at home mutate into permanent working from home? And I think that, you know, we are probably now at the point where actually people are now at least quasi or certainly to some extent permanently working from home now, whereas they'd only intended to start temporarily working from home. I think generally for the guidance, it does get updated on a fairly regular basis, and I think it's very important for employers to keep up to date with the latest guidance. What I've always recommended is that employers try and keep a hard copy or get a PDF of the current guidance from time to time, so that, you know, if you ever did get the phone call or the knock on the door and somebody scrutinized or wanted to scrutinize why you took a particular action at a particular time, you could point to the then guidance and say that it was current with that guidance. So it's I mean, the situation is clearly a fluid one, and it's really important to keep up to date with the guidance from time to time.
No, great. Gavin, any thoughts on that?
Yeah, no, interesting, because I think just the idea that you have to have kind of reasonable evidence to notify seems like an odd concept in the sort of idea of notifying something to the HSE. You'd sort of think that they'd want to know whether you thought you had an issue of potential coronavirus disease, without having to establish that you had reasonable evidence for it. It seems a very odd way to do it. Now, whether that is indicative of the fact that they were concerned that they might get overwhelmed with, people notifying circumstances which, where there was no real occupational exposure. I think it seems to suggest that to me anyway. But it just feels very odd to have that sort of, before you notify, you need to have reasonable evidence before you notify, and that's an interesting kind of idea, I think.
Yeah, and another point is, I mean, we talked earlier about there being two systems running in parallel. You have the coronavirus regulations from a public health perspective, and then you've got the health and safety legislation continuing to run. And Gavin, you talked earlier about the advice being that if you have 2 or more people diagnosed with COVID-19 within 14 days of each other, the employer is required to, or is advised, I should say, to notify the local health protection team. So you've got that advice, but then in parallel, you've also got the RIDDOR reporting requirements. And some circumstances, you might be required to make a RIDDOR report, but not notify the local health protection team. But then in other circumstances, you might be required to notify the local health protection team, but not make a RIDDOR report.
Yeah.
So again, you've got this strange sort of dichotomy of the two regimes going on in place. So I think it's clearly not enough to be up to speed on all of your health and safety legislation. You do need to know as an employer what the coronavirus regulations require, and ditto. On the other side, it's not just enough to know what the coronavirus regulations say. You also need to know your basic health and safety obligations and duties as well.
It's not making it easy for people, is it?
That's why they need really good lawyers like me and Gavin.
There you go. It's a sales pitch that you can get in as well. Absolutely.
Rob can make that claim. I'm not sure I'm making the claim.
Listen, no, that's been great. I think there's been some really interesting points and topics around that for the last hour and a half. we've got a couple of questions that we might try and touch off if we can. So the first one is just in relation to risk assessments, I think, really. And it's kind of saying that, so the reader, Simon, has looked at a number of webinars and listened to a few different sort of solicitors and barristers talk, but not sure about the requirements on COSH assessments, or if there's any change or impact on COSH assessments requirements. Any thoughts on that?
I think in the early stages there was certainly a lot of talk about about COSH assessments of coronavirus. I haven't seen very much more recently about that, I have to say. I don't know if Rob has.
No.
But I think the kind of the risk assessment here seems to be the main focus. I'm going to be interested if anybody else has had that. But I mean, I've seen there were some talks given in the early stages of the pandemic about whether it was a pathogen which fell under COSH, but I've not seen anything more recently about that, I have to say.
No,
if you're demonstrating. Sorry, go on, yeah, Rob.
Sorry, the most I've really seen about COSH is more in terms of the preventive measures that people are putting in place. So what cleaning equipment are you using? What substances are in those, and make sure that people have got adequate PPE to protect themselves from those substances. But no, I agree. Aside from the actual template risk assessment for COVID-19, I haven't seen anything specific for COSH.
So yeah, unless there's a change in the chemicals that you're using or the substances that you're using because of this, other than that, it's really focused on the standard risk assessment, the operational side of things. Good. Okay, great. A question from Bridget. Do the speakers think that the template from the HSE is suitable and sufficient? And Bridget is just noting that it doesn't follow the HSE's own guidance for defining a hazard. Any thoughts from you guys around that?
I think the HSE will probably say themselves that it's not supposed to be sort of copied verbatim. It's only there to be an illustration and a tool, and it doesn't allow employers to sort of abrogate their responsibilities in that way. I mean, I think the fact of the matter is, in all likelihood, a lot of employers are probably just copying it verbatim anyway. But I think the HSE would probably say that you shouldn't be doing that. It's purely there to sort of provoke debate and discussion within an employer, and it's an example. It is a tool. It is not the finished product. So yeah. I don't think it can be seen per se to be suitable and sufficient, but it is a starting point to inspire maybe some of the employers as to what they should be doing.
Yeah, I mean, I think it's an unusual situation, isn't it? And so the risk assessment is going to be different from other risk assessments, I think. And is it suitable and sufficient? Well, as the HSE are going to be the enforcement agency for most of these things, and that's what if you use it, then I think you're in pretty good shape if you use this as the basis. I think because it's going to be very difficult to suggest that you've adopted it, that it's not suitable, sufficient for you. I mean, I agree that you might have an academic argument about whether they adopted the right approach to the hazard, but I think on a practical basis, I don't think it's going to be a problem.
And so yeah, I think the point there is generic is bad. Don't copy paste exactly. Assess it for your business, but the template is like you said,
I mean,
they're enforcing them.
Yeah, I mean, risk assessments have to be on the basis of what's in front of you. It's
exactly.
It's not a one. It's a kind of one size fits no one, isn't it? You've got to adapt it to your individual circumstances.
Perfect. Okay, we have another question from Niall, if we're okay. I know we're just on the 11 o'clock, but hopefully you guys are okay for another minute or two. The Legionella contamination. So Niall would welcome an overview in terms of any landlord or employer responsibilities. If you have any thoughts on that.
I think I should probably start off on that one, seeing as I covered it off. I mean, yes, I mean the risk is going to be more acute depending on your specific building. I mean, you should already have assessed the risk to some degree from Legionella, and you will need to certainly consider if your premises are not being used fully, if the water system is not being turned over on a regular basis because there aren't that many people in the building, then certainly you should review your risk assessment and look at what it tells you to do in terms of taking any further action. So I would suggest in the first instance, have a look at what your current Legionella risk assessment says, and take the appropriate steps. But the older the building, the older the infrastructure within the building, the fewer people that you've got in there, then yes, the higher the risk from potentially from Legionella. So I would suggest you look at your existing risk assessment and work from there. But certainly something to be borne in mind.
Yeah.
Definitely.
Okay, and the last. Sorry, go on, Gavin. Yeah.
No, well, the only point I was going to add to that, which I think is absolutely perfect, is just the fact that I think Public Health England, did identify that when people were going back into the office, that the likelihood was that there were going to be more Legionella cases of Legionella because of the stagnant water being in the systems, people not being able to get in, and so on. So I think obviously, as we're going back into another lockdown now, that will be the case when we go back in a month's time, if we do, and that again it will be the same situation. So people just need to be aware of that.
Yeah, perhaps sort of proactive testing before going back into work, things like that as well, just bringing all that back in. Yeah. So just for any existing customers there, I know one of the workshops has started over there. We're just going to wrap up with one more question here. So on the other stage, the workshops have started if anyone wants to join those, but we'll just try and do the last question if we can while we're here. So interested to know from the speakers, from Richard, at what time should we consider changing from a temporary home working scenario to moving to permanent home working? Or is there any HSE guidance on this? At what point does it switch over from this is something that you're doing, temporary to now this is the usual?
I don't know. I mean, I don't know if Rob knows different, but I don't know that there is a specific time period. But I mean, certainly from my point of view, it seems to me, I've now been working at home for 7 months. I don't think that is temporary anymore.
Yeah,
that is a pretty, that feels pretty permanent to me. And now it looks like I'm going to be working at home for another month at least, and then after that there'll be a period of time when we're going back. So I think for many people that I think it would be difficult to describe it as temporary now. I don't know what Rob thinks.
Yeah, it goes into the how long's a piece of string type argument, doesn't it? It's very difficult to measure. I mean, personally speaking, I've been going back into the office over the last 2 or 3 months or so, and tomorrow will be my last day back in the office for the foreseeable future. So it's a very difficult one to call, but I agree that I think probably we are now at the point in which it is starting to turn. And I think probably up until now, you could have got away with the argument that that they are working from home temporarily. But now I think it's probably the onus is going to be on you to demonstrate that is still the case.
And I think again, it is, it's going to be, dependent on what your organisation is doing.
Yeah.
What is the position? Each organisation is going to be slightly different, and you may have taken the decision to move to home working at different times, or there may be a mixture of some people in and some people out, and and they may be changing all the time. So I know some people, we have been doing working on the rigs type thing a bit, where we do 2 weeks on, 2 weeks off, and I know a lot of organisations have been doing that, and so that sort of complicates the position as well, I think.
No, great. Thank you very much. So look, I think that's probably a natural wrap up. I think we've gone a few minutes over, but like I said, it was my fault we started a few minutes late. So we're pretty much on time in my head, right? The existing customers, like we said, if you are going across, the workshops have started over on the other stage, you'll have access to those. If you're not in the exhibition booths, you can talk to anybody from our customer success team or sales team. They're in there if you want to have a chat about anything that we do. I suppose I want to say a big thank you to Gavin and Rob for coming on and sharing their thoughts and some really interesting learnings for the talk today, and for helping support the charities again. So As I said, if you've been listening intently and you're taking some, some good takeaways and learning from this, please, a couple of pounds or euros towards the charities would be hugely appreciated to try and help those causes. So, thank you guys. Thank you everybody for listening, and we'll see you again on the next session. Cheers.
Cheers.
Thanks, guys. Cheers.